Trevino's a patient that came to see us here at the beginning of this past summer who has been battling his entire life with a disease called fibrous dysplasia. Fibrous dysplasia is a disease where individuals get abnormal growths of bone in various areas of their body. And in most people, it's not a very severe problem. It tends to be in one or two places. They have it taken care of and they're sort of finished with it. But in Mr. Trevino's case, it's something he had been battling his entire life. He'd had multiple previous operations, had to have one of his eyes removed because of one of these bony masses growing into his eye socket.
Over 30 years ago, when I was about 7, 8 years old, my parents started noticing something different than me. That appearance of my face and everything. They knew I had it on other parts of my body. The main goal was working where I had it, which was probably the worst place at that time.
The reason he came to see us is that some of this bony abnormality, this bony growth had begun to occur in his ribs, in his chest wall. And unfortunately, rather than growing out away from his chest wall, the bony masses were growing inward. And basically his left lung was completely obliterated by a mass that had completely filled the left lung space. Despite the fact that he was only 40 years old and was not a smoker and had taken good care of his lungs in general, he was suffocating. Mr. Trevino actually showed up in Dr. Scott Reznik's clinic. Dr. Reznik works with me in the Division of Cardiothoracic Surgery, and Dr. Reznik obviously said, I think you're going to need some sort of surgical treatment for this disease. I'm afraid it's going to end your life.
We felt we could help him and that we could re-expand his left lung and give his right lung more room to work by having the heart shift back over to the middle of the chest. But he wanted to think about it because I also told him that if the left lung didn't expand for whatever reason, he may not be able to survive the operation. And I told Mr. Trevino that whatever plan we had, we're going to have to think about it carefully, and that there's going to be a big risk but a big reward, and that he needed to really think about it.
He said, that left lung is shot, and I'm going to tell you this, what you have there, then what we have to do is very risky. I told him, well, okay, doctor, if I don't have surgery, what time do I have left? He said, can't tell you. Weeks, months, maybe a year. Woke up the next morning thinking about it, just like, what do I do? Do I change my mind? Do I have surgery? And I don't know what happened. Something just went over me. Real quick, and just like, I was different perspective that, you know what? I'm going to decide to have surgery. It's not my time to go. I'm not done here. I got a lot of things I want to do.
Really, there were no surprises in regard to the mass itself, where it was, what it involved, and it was just as difficult as we thought it was going to be to extract it from the chest. The one thing that we didn't know, again, is the issue of whether or not there was any functional lung in his chest or underneath this mass. Normally, at this point of an operation where you're removing a mass from someone's chest, the hard part's over. The hard part of this operation was standing there waiting to see if this lung was going to inflate. We had the anesthesiologist unclamp the tube, and over about the next 10 minutes, that left lung, which had been compressed and flattened and not even visible in an x-ray for probably 15 or 20 years, completely re-expanded. We don't do high fives in the operating room because you have to maintain sterile technique, but we were obviously very happy. We still had a lot of operating to do. We had to reconstruct his chest wall. He had a large opening in his chest wall where the ribs had been removed. We had to put all the muscles back together. It was a huge incision that started on the side and went all the way up to the base of his neck. We had to close that, but I don't really remember the rest of the operation after that. We were so excited.
It was really a moment of truth, and we don't always have that in thoracic surgery where you know that something is going to work. But when we asked the anesthesiologist to inflate the lung, we really came up and we were thrilled. And we knew that we had helped him immensely and that he just had to recover from the operation, but that his lung function was essentially doubled almost, in that 5 minutes that the lung came up.
We all tend to remember, a few landmark cases in our careers. I'll always remember this case, but what I'm going to remember is Mr. Trevino's courage. Even if when I'm older I forget the technical aspects, I'll never forget that. Never.
Dr. Smythe and Dr. Reznik really made me feel comfortable knowing the circumstances. I think about them every day because, you know, they're the reason why I'm still here. They didn't give up, and they gave me a reason not to give up.